headlines. Our top story now, a team of 11 South African health professionals is preparing to leave for the Ebola-hit Freetown in Sierra Leone on Friday. The team will assist with the treatment, the team will assist with the treatment of thousands of people there who are infected with the deadly disease in West Africa. A team of 10 nurses and 1 medical doctor is planning to stay in Sierra Leone for 2 months. Right to Care, an organization that has recruited the health professionals, briefed the media on its plans in Johannesburg yesterday. Now, for more on the story, we're joined in studio by Dr. Pappie Majuba, who is the Chief Medical Officer at Right to Care. Doctor, a very good morning to you and welcome to AM News.
Thank you very much.
Now, Right to Care, how did you get involved in this program?
Okay. Right to Care is a South African non-profit organization that has been supporting the South African government on a variety of issues, specifically HIV, TB, and other infectious diseases. Now, Ebola is one of the infectious diseases. So I think when the call came last year, when the WHO, the World Health Organization Director General, declared Ebola a public health emergency of international proportion. We felt that as part of the South African response, because I think Ebola is one of those infectious diseases that without international cooperation and response, it's very difficult to control as a country if you are affected. So as part of that response, there are a lot of response teams. There are lab technicians, there are other logistical transport and evacuation preparations. But one of the issues is that because those countries come from a strife-torn, past, the infrastructure there is very poor. The health system is not up to scratch. So I think there's a need for more healthcare workers as part of that whole team of the response. So that's how we came about to be involved, obviously under the Department of Health initiative. 10
nurses, 1 doctor. Do you think that they are ready?
Yes, they are ready.
Why?
They are ready because they've been, I think they are a team that has been selected from, I think, over 50 candidates in the first group of getting the staff who responded to our advert to say we needed a certain type of caliber of healthcare workers. So I think a lot of people could go there, but I think because of the stringent measures that we have put in place, we for this first group, we could only take the few that are going.
You're talking about stringent measures? Talk me through those stringent measures.
Okay. I think the most important thing about all viral hemorrhagic fevers, which Ebola, which is one of them, and which is one of the deadliest of all of them, is infection control. Because I think what is dangerous about it is that if you don't take precautions as you care for patients, you may contract the disease, and that is what we are trying to avoid. We don't want to take people there for them to contract the disease. We are taking people there who will be ready to be able to take care of themselves, for them to be able to take care of the patient. So I think the stringent infection control measures training, it's training about infection control more than other things. There are other issues, obviously, but I think the most important one is infection control, so that they can be able to carry their duties there.
How long did the training take here in South Africa?
Here in South Africa, it takes a week. And then once they arrive in Sierra Leone, it will take another week. So
is that enough, though?
It is enough, I think, based on the intensity of the training that we give, because, as I said, it's a group of medical people who are experienced in trauma, ICU, emergency situations. This is just a specific one to ensure that they don't get infected. But they are well trained, so we are confident that they are ready.
What exactly will be their task when they arrive in Freetown?
as I said earlier, I think there are other teams. The team that we are taking there is mainly to care for the patients who come in the Ebola treatment center. So people who get infected, they get referred to the Ebola treatment centers. That's where there is a shortage of healthcare workers, and that's what the team is going to be doing, just treating those patients who come into those centers.
Now, this is a very risky mission. Yeah. What motivated these 10 people, or even the 50 that is applied to do this? Yes. What motivated them, you think?
I think there is it's a pity that we couldn't bring one of the team members who are going in there. I think speaking to a lot of them, I spent a lot of time with them. I think it goes beyond just enthusiasm for the work, but it's more, some of them, they call it a calling to make a difference. I think it emanates from what one experienced public health specialist once said about Ebola, to say the only way we can stop this epidemic or this outbreak is for us to fold our hands and to roll up our sleeves and work. So I see a lot of dedicated people out of this group, people who've got I think a chance to make a difference. And secondly, they want to be part of the experience that we must build in this country, because one day we may not know, it may come into this country. And a lot of people know about diseases like this theoretically, and this will be one of those experiences that they will, I think, gain and ensure that South Africa is prepared for the future. We are building that capacity, because all of us, I'm a doctor myself, I can tell you all about Ebola, but if I don't get the on-the-ground experience, I think it gives you a different perspective if you are there, and I think that is, experiencing it firsthand is the better teacher.
If this was a blockbuster movie with superheroes, they will be probably called Superman and Superwomen.
Yes.
Now, what do you think, Doctor, in your own perspective, Ebola as an epidemic?
Yeah.
Will we be able to stem this epidemic?
I think so. I think all the effort that has been put. I mean, we are also part of the team that is going to be doing a lot of research in terms of treatment as well as vaccines. South Africa is part of that international effort. Most outbreaks such as this never lasted for more than 6 to 9 months. This is the first time that we have an outbreak like this which has lasted more than that. Now, the reason being that I think it's the first time that in West Africa we had conditions which allowed the outbreak to increase. But I think now there are reports now that it's starting to incidence, which means the rate at which new infections occur is leveling down, and that I think gives us an idea that by the close of this year, I think we'll have had a control over this.
Doctor, just briefly, 10 seconds. Are you going to take another team of people going over?
Yes. It's an ongoing thing. I mean, as the group leaves, we are busy now recruiting for the next group, as well as having to train them, and so it will be an ongoing thing until the outbreak is defeated.
Doctor, thank you so much for your time and coming in to AM News. Now,
thank you.
That was Dr. Pappie Majuba, the Chief Medical Officer at Right to Care. We got to